Hi. First time I do this live. Thanks for joining us. اسمي دكتورة نيكول المرج أخصائية علم النفس or clinical psychologist based at AUBMC. My main roles here are the psychologist at the inpatient unit and something we call the partial hospitalization program or PHP. I'll be talking a little bit more about that later on. For now, I think I'd like us to celebrate that it's World Mental Health Day. So this is an important day that's celebrated annually on the 10th of October, and it is a day to raise awareness on mental health related issues, provide education to the wider community. So I'd like for us to talk about that. So this year's theme is actually suicide prevention. So I think it might be helpful for us to think a little bit about suicide rates. So according to the World Health Organization, approximately 800,000 deaths occur by suicide per year, which is quite a significant number. We also know that suicide has been gradually increasing year by year, including here in Lebanon. So we do know that this is something that obviously requires our attention and something that we need to weigh out options and to think about how it can be prevented if it can be. One of the things I often get asked is, can it really be prevented? It's debatable, but there are things that we can do to help support one another and to notice early warning signs, for instance. So some of the early warning signs that may indicate a person is experiencing a mental health difficulty requires that we notice they might have a change in their behavior. They might be spending more time alone. They might be withdrawn. They might be isolated. The person might feel low in mood. The person might have changes in their eating or sleeping pattern. And if we notice some of these things, they might indicate that this person is experiencing some sort of difficulty. So what do we do then? I think that's the question to hold in mind. It's probably helpful to approach that person and to talk to that person. Some people think that if they directly ask someone about suicide, then this can be triggering, when in fact we know that it actually can reduce the person's experience of anxiety and allows them to feel cared for and looked after and listened to. So I would encourage that if you suspect someone might be going through a difficult time, that you have the courage to approach them, spend some time with them, ask the question if they have thoughts about harming themselves in any way. I think it might be a good idea for me to transition to what I wanted to talk about as well, which is the PHP program. So the PHP program, also known as the Psychiatry Partial Hospitalization Program, but PHP for short, is a program that has recently been established in Lebanon for individuals with severe psychiatric illnesses that may require hospitalization or that have been hospitalized, and this is sort of a step down or a transition after they've been hospitalized. So it's a more intensive treatment program that we have available here. And it is the first of its kind, I'd like to say, in Lebanon and in the region, so in the Middle East. نعمل هيدا ال PHP program because we realize that there is a need for individuals to have a more intensive treatment program available rather than simply the outpatient. So this program is comprised of a multidisciplinary team, and the multidisciplinary team includes an attending psychiatrist, clinical psychologists, social workers, registered nurses, occupational therapists, art therapists, and we work together to put in place a plan or a treatment plan for the individuals that come to seek support from us. And individuals come in typically for a half day from about 8 to about 2 p.m. and they're involved in a number of various group activities, which might include skills building, goal setting, learning emotional regulation skills, art therapy sessions. So there are a number of things that they're involved in throughout the day, including, of course, individual sessions with the psychiatrist or the psychologist. And typically, if we think that a person is eligible for the PHP program, we would require a minimum of a 2 weeks commitment. This is on a case-by-case, but usually it's about a two weeks commitment at least, and it can go up to about 4 to 6 weeks for some individuals as well. I think that I would welcome questions if we're getting any at this point, maybe about the PHP, or no questions at the moment? Okay. So maybe I can talk a bit about the types of groups and what we do in PHP. So if a person presents to PHP, they might be involved in, say, skills building groups. And during these skills building groups, they focus on developing healthy coping mechanisms. So some people that participate in these types of groups might have unhelpful thinking habits, and we would tackle these sorts of things, help this individual to develop healthy coping strategies, to look after themselves, and ways to deal with stressors, identifying what these stressors are, knowing how to respond to them when they're put in these situations. Other things that we encourage is goal setting. So for instance, with goal setting, individuals set realistic and attainable goals for the short term and the long term. So for the short term, while they're working with us in a group environment, and in the long term after they've been discharged from this sort of program. One of the things we also know that's quite helpful for individuals to learn is emotional regulation skills. So in these groups, we focus on bringing awareness to the present moment for people to recognize what emotions they are experiencing and to learn how to regulate them in healthy ways so that they're manageable and less overwhelming. Occupational therapy types of groups focus on promoting the health and well-being of individuals through practicing life management skills, such as learning to be more independent, promoting active engagement in the community or in their occupations and other roles in life. The support group sessions focus on providing a safe and containing environment for individuals to process their feelings and to express them while it being sort of a therapeutic milieu, so to speak, and to hear the experiences of other people as well. We also focus on healthy eating habits. So one of the segments that we have as part of the PHP program is that the nutritionist provides sessions on how to eat healthy meals, what to eat, things like that. So she provides education on healthy eating habits in general. So I wonder if we don't have any questions yet.
Is suicidal thoughts noticeable in children? And what about the signs that we should look for?
Okay, so suicidal thoughts can occur in young people. Actually, it is suicidal behavior is the second leading cause of death in individuals between the ages of 15 to 29. So although the misconception is that suicidal behavior occurs in an adult population, we do know that it can occur in children or younger people, or young people in general as well. The signs to look out for typically are sudden changes in behavior, a decline in school performance, possible behaviors, suggestive behaviors to look out for are spending time in their room, being isolated, not communicating as they typically would. If they express that they are experiencing distress, any sort of indication of bullying as well. So what I would do is, if you suspect that a child might be going through a difficult time, it's also helpful to contact their teachers at school to see whether they're noticing a change in behavior as well. And to, again, I would say approach the person, young or old really, at any age, do approach the person, do talk to them. do provide that care and support and ask them if something's going on with them and if they would like to talk. And if there are ways that you can be supportive, and they might have suggestions on how you can be supportive.
What are the steps to take in case of a severe case?
Okay. So if there is a previous attempt of suicide, that's also a red flag and something to hold in mind. But the steps to take typically, if a person is or has been contemplating suicide, after you've spoken to the person, what I would suggest is that you also tell them that they need to seek professional support, so they can speak to a mental health counselor, consider seeking therapy, maybe even seeing a psychiatrist. So encouraging them to seek support from a mental health professional is a good idea. If the case is imminent and if the person is in immediate danger, has a plan in mind or has the thoughts intrusively and feels distress, then of course as well we would suggest that we bring the person to the emergency department, to your nearest hospital, for them to be assessed and seen by a team, because they may need to be admitted to an inpatient psychiatry unit.
So, okay. Thank you, Dr. Nicole, for this information.
Thank you for your time.